For 1 in 10 women in the UK, this is their reality. Months of nothing and then period that is heavy and painful and seems to last forever. This is the paradox of polycystic ovarian syndrome. In this video, I'm going to explain to you the surprising hormonal reason behind it and how you can get it back in control. Hello, my name is Saurabh Phadnis and I'm a consultant gynecologist and gynecological oncologist, and one of the conditions that I treat is polycystic ovarian syndrome. There is a great deal of confusion surrounding polycystic ovarian syndrome, but the commonest question that I get asked is about bleeding. How can a condition that is known to cause lack of periods may also be responsible for causing the heaviest, painful, and unpredictable bleeding imaginable? It's a frustrating and valid question. The answer lies deep in the hormonal imbalance that defines polycystic ovarian syndrome. Today I'll explain why this hormonal imbalance occurs and how we can manage it with medical and lifestyle changes. So let's solve this paradox. In a normal menstrual cycle, when often you will have ovulation, and after ovulation there is rise in progesterone level in the body. The function of progesterone is to keep the lining stable. If you don't get pregnant, then there is drop in progesterone and you have a normal cycle. In polycystic ovarian syndrome, there is infrequent ovulation. Therefore, there is lack of progesterone. You may consider this as progesterone deficiency. Therefore, estrogen is the main hormone that is influencing the lining of the uterus. Estrogen thickens the lining of the uterus, and over a number of months, the lining gets thicker and thicker and thicker until it reaches a stage where the lining separates. That causes the torrential flooding. This is not a normal period. This is just breakthrough bleeding due to the separation of the lining. Have PCOS and heavy bleeding? It might not be the only reason. Here's what else we check for. When I see a patient with polycystic ovarian syndrome and heavy bleeding, I never assume it is because of hormonal imbalance. Before we attribute hormonal imbalance to these symptoms, we need to be absolutely sure that we are not missing any other cause. What other causes can cause heavy bleeding? Often it can be an endometrial polyp or uterine fibroid. Therefore, investigations such as ultrasound scan are helpful, and sometimes if the ultrasound scan has not identified, I can use a small camera called hysteroscopy to examine the lining of the uterus and ensure there is no hidden polyp or fibroid. Once we have done all these investigations, then we can attribute hormonal imbalance as the cause for heavy menstrual bleeding in polycystic ovarian syndrome. Want to stop heavy PCOS periods? This simple device is a game changer. Once we are confident that the cause of heavy menstrual bleeding in polycystic ovarian syndrome is hormonal imbalance, our job is to restore that imbalance and provide the progesterone that is missing. Often the easiest way of doing this is to use a hormonal intrauterine device, or commonly the Mirena coil. It is effective in controlling the periods, thins down the lining of the uterus, as the hormonal coil has a small reservoir with progesterone that is released over a number of years. Many of my patients after insertion of a hormonal intrauterine device have lighter vaginal bleeding, or they stop seeing periods. Almost 70% of women with hormonal intrauterine device do not have periods at the end of 1 year after insertion. There are other methods where we can supplement the body with progesterone. Often a progesterone pill may be useful, or even the combined oral contraceptive pill. It is a matter of investigating what is the right method to supplement this progesterone in a particular individual. Everybody's needs are different. Does PCOS ever need surgery? Here's the surprising answer. This is a common question. If the bleeding is associated with hormonal imbalance, then the answer is no, you do not require surgery. The problem is hormonal, so the solution is medical. But surgery may be required in some patients. This is because there may be a coexisting or other factor for heavy menstrual bleeding or pain. You might have an endometrial polyp, which may need surgery to remove, or a fibroid, or endometriosis. If you have endometriosis as a coexisting condition, then you can have pain. Therefore, laparoscopic surgery may be required to remove the endometriosis or remove the fibroid. Therefore, the answer to this question is if solely hormonal imbalance is causing heavy menstrual bleeding, then you do not require surgery. But if there is a coexisting condition, then we are treating the coexisting condition with particular surgery. Trying to get pregnant with PCOS. For many of my patients with polycystic ovarian syndrome, starting family is a priority. The many methods of treatment we use in polycystic ovarian syndrome are contraception. Therefore, we cannot use that strategy if you are trying to get pregnant. Most medications that we use in polycystic ovarian syndrome are either hormonal medications or a contraceptive coil, which is also hormonal. The first step, if you're trying to get pregnant, is to stop the hormonal medications and concentrate on symptomatic relief of your symptoms, particularly heavy, painful menstrual bleeding. We achieve this by using non-hormonal medications. We then move on to concentrating on the strategy of conception. One of the commonest reasons why you would have irregular, heavy menstrual bleeding in polycystic ovarian syndrome is lack of ovulation. Therefore, your consultant might prescribe you medication to induce ovulation. If this does not work and natural conception does not occur, you might need to refer to a fertility specialist. The most powerful way of managing PCOS isn't a drug. It's this. In polycystic ovarian syndrome, many patients have disruption in the insulin pathway called the insulin resistance. This is a hormonal imbalance and causes a lot of symptoms of polycystic ovarian syndrome, including weight gain. Dietary control and lifestyle changes help manage these symptoms. These are important part of the strategy of management of polycystic ovarian syndrome. I often say to my patients that they may need consultation with a nutritionist who are knowledgeable in dietary input of hormones. Many patients do not realize that our diet has got hormones. Vegetables like broccoli are rich in estrogen hormone, such as soya bean and soya milk. Therefore, it is important to concentrate on dietary and lifestyle changes along with the medications with a holistic approach to management of polycystic ovarian syndrome. For many women, even a 5 to 10% weight loss is enough to restart ovulation and regulate your cycles. This is not a quick fix. It's about a sustainable long-term strategy that empowers you to manage this condition inside out.